Here we have the male reproductive system. We can see the testes, where sperm production is going to take place, with the epididymis around it. So remember, sperm undergo meiosis within the testes, then they'll travel from the head of the epididymis down to the tail of the epididymis, and then during ejaculation they'll go up and out through the vas or ductus deferens, which you can see much clearer here as it goes around the bladder. You'll add secretions from the seminal gland here, as well as the prostate underneath the bladder. And then there's also the bulbourethral gland, cannot see in this particular image, and then eventually out through the urethra, through the tip of the penis. Now the testes are held within a sac of skin that hang down from the pelvic cavity called the scrotum. This is because of temperature. Sperm optimal temperature production is about 4 degrees Celsius lower than the body temperature. Now we can remove the front half of the bladder here, just so you can see on what we are removing. Here is the bladder, the prostate just below that bladder, inferior to it. Then you have the seminal gland here, or seminal vesicle. You can remove that seminal vesicle to see the internal contents of that gland. And then up and around the bladder, meeting with that seminal vesicle, is the vas or ductus deferens there. As we take a closer look in the model with the front half of the bladder removed, we can continue to see that ductus deferens. As it connects with the seminal gland, it'll become what's called the ejaculatory duct, which meets up with the urethra from the bladder up here. That is then going to go through the prostate. You can see the back half of the prostate here, the ejaculatory duct coming in to meet with the urethra. And then that urethra would continue until it comes out through the tip of the penis here. And you can also see that erectile tissue. You have the corpus spongiosum surrounding the urethra, and then the paired corpora cavernosa on either side. So again, you have testi, epididymis, the bladders here, prostate. You have the ejaculatory duct with the urethra. Testes are within the scrotum. Urethra comes out through the tip of the penis. When we have everything connected here, we can see the prostate again, seminal gland, and that vas or ductus deferens. This is actually what's cut during a vasectomy, so that way there are no sperm that will be in the ejaculation, just the secretions from the seminal gland and the prostate.